All right. And then if other students come in, they'll still be able to come in and play.
Okay.
All right. The nurse notes a steady trickle of blood from the vagina of a postpartum mom. The fundus is firm. What might be the cause?
I don't know. I would say like bladder distension, but the lacerations, yeah, I consider lacerations too.
Yeah, if we have a lot of bleeding, but the uterus is firm, then where's the bleeding coming from? And so usually the next consideration is a laceration. Which of the following complications is most likely responsible for a delayed postpartum hemorrhage?
Delayed.
So delayed postpartum hemorrhage happens after the first 24 hours.
Okay.
Okay, so in the first 24 hours, that's what is when we're really worried about acne. And then after the first 24 hours, we're worried that the uterus isn't returning to its pre-pregnant state. So uterine subinvolution. Do you remember the two main things that can contribute to uterine subinvolution?
Let me think. I don't remember. Like, I don't know. Like it's not it's obviously not contracting. I don't know.
Yeah,
I
well,
don't
it
know.
isn't. You're right that it isn't contracting. So something is inside keeping it from doing so. And so our two biggest causes are retained placental fragments
And
and
bladder.
well, bladder distension is going to be something that does decrease contractility on our early hemorrhages, but it's not really the contributor to subinvolution. The other one is actually infection, endometritis.
Oh, okay.
So if you have infection of the endometrium, or if you have retained placental fragments, that is what is keeping the uterus from returning to its pre-pregnant state.
Okay.
And that then also causes more bleeding.
I was gonna choose maybe clotting because of the placental fragments, but I guess placental fragments isn't clotting. I don't know.
Yeah. Well, uterine subinvolution was the right answer. So
yeah. Okay.
this is given before giving a postpartum client the rubella vaccine. What should the nurse include in the teaching for rubella? Good. So she shouldn't get pregnant. Do you remember why?
I don't I don't know. Is it because of I mean, is it a live vaccine? No.
Yeah. Yeah, that's why.
Oh, okay.
Yeah. It's a live virus. And so if she gets pregnant while her body is trying to build the antibodies, it can affect the new embryo. Which of the following circumstances is most likely to cause uterine atony and lead to postpartum hemorrhage? This one was your bladder. Uh-huh. All right, so uterine atony is what's happening in the first 24 hours after delivery. And that's when we think about that also can be retained placental fragments, but we're thinking then like the bladder distension and stuff like that. It's subinvolution where we start thinking about endometritis being a contributing factor.
Okay.
A nurse examines the breasts of a prima paris breastfeeding mom who's on 1 day postpartum. An expected finding would be what? 1 day postpartum. All right. So when do you think that the colostrum transitions to mature milk?
Isn't it like 3 days?
Yeah.
Okay.
And so this is a prima paris breastfeeding mom on the 1st day postpartum. So she doesn't really have mature milk yet. She has colostrum still. The nurse is documenting assessment findings on a client 14 days postpartum, which indicates a normal involution process. Okay, 14 days. The fundus is below the pubic symphysis and not palpable. How much does the fundus go down per day?
1 inch or centimeter.
Yep, about 1 centimeter. So 14 centimeters is definitely down where you can't palpate it anymore when we're thinking about 14 days. Which instructions in the discharge teaching plan assist the patient in recognizing early signs of complications? Good. So return to bright red. Do you remember the progression for lochia?
It's rubra, serosa, and the white one.
Yep.
I forget what it's called.
Yeah, that's right. The white one is called alba.
Alba. Okay, alba.
Yep. And so if it goes back to rubra, that's wrong, right? It should go red, pink, white, not red, pink, red. So if we have increased bleeding, or if we go backwards on our color change, then that's a sign that something's wrong.
Yeah.
15 minutes after the delivery, both pads are soaked and she's lying in a puddle of blood. What should be the priority action?
Yeah. I don't know.
Massage the fundus, first thing. She's lying in a puddle of blood, you probably do need help. But the very first thing you should do is massage the fundus.
Okay.
2 hours post-delivery, the fundus is 3 centimeters above the umbilicus and to the right. What can bladder distension cause postpartum? Good. Yep. 12 hours post-delivery, the fundus is 1 centimeter above the umbilicus. Which action is most important for the nurse to take? All right, so 1 centimeter above the umbilicus might be fine. It doesn't really tell us for sure, like much more information than that. And so 1 centimeter above might be fine, but it also might not be fine because we usually see it like at or below, like 1 centimeter below or at the umbilicus. But the umbilicus is such a subjective assessment tool. Do you know what I mean? Because different women's belly buttons are in different places depending on their habitus and stuff like that. So for this question, charting the results in the chart because you're thinking they're normal, like that makes some sense, but let's just make sure the lochia looks okay before we definitely say, oh, sure, this patient's fine. Does that make sense?
Yeah. Yeah, it does. These questions are hard.
The nurse lists fever, foul-smelling discharge, and subinvolution of the uterus as signs of what condition?
Mm. Oh, sepsis. I was thinking of chromoamnionitis, but
Oh, I gotcha. Well, chorioamnionitis is going to be a condition that happens while she's still pregnant.
oh,
Right. So the big infection when there's still a baby in her uterus is chorioamnionitis. The big infection when the baby's out is endometritis. And so
okay.
that's when the area where the placenta was attached is now very susceptible to bacteria. And so then the infection can happen right there in the endometrium. So for this patient, she has fever and foul-smelling discharge. So you're thinking there's something infected, right? And then subinvolution of the uterus. And so remember that we already said that endometritis is one of our big causes of subinvolution.
Mm.
And so now we're thinking, okay, so she probably has endometritis. She has an infection. Of the answers, it doesn't say endometritis, but it has sepsis. And I'm going with sepsis. Because if her infection goes untreated, she'll become septic.
Mm-hmm.
The nurse applies ointment to a newborn's eyes after delivery. The nurse explains that this is used for which purpose? Good. Neonatal conjunctivitis. Do you know the big causes of neonatal conjunctivitis?
No.
No. Typically chlamydia and gonorrhea.
Mm.
But every baby gets erythromycin eye ointment for this purpose.
Mm.
The nurse notices a newborn has a large cephalohematoma at 24 hours of life. What intervention has the highest priority?
Mm. My phone's being slow. Oh.
Okay. So knowing that the answer is to assess for jaundice, why would this baby have an increased risk for jaundice, do you think?
I don't know.
Okay. If we have a cephalohematoma,
Which is,
yeah, what is that?
I don't know, like it's a hematoma, so they're bleeding somewhere.
Good. Yeah. So, you know, if you were looking at this as a test question and you're like, I have no idea, you could at least start to tease out that. So hematoma includes blood, right? Now,
Mm-hmm.
a cephalohematoma, cephalo is head. And so the
Oh.
hematoma is on the baby's head. And this can happen as part of being born, especially like if we use a vacuum to get the baby out and things like that. So if the baby has a cephalohematoma, the baby's body is going to have to break down that blood. And a byproduct of the breakdown of red blood cells is bilirubin. And high bilirubin is what causes jaundice. Make sense?
Yeah.
Mismanagement of the third stage of labor can lead to complications. Which should the nurse attempt to avoid? What's the third stage of labor?
Isn't the baby's born?
That's, yeah, the baby's out. And what's happening during the third stage?
The placenta
Right. Yeah.
being
The placenta's
delivered.
being delivered. Yeah. And so when it talks about mismanagement here, if there's too much traction on the cord while we're waiting for the placenta to detach, it can cause the uterus to turn inside out and come down into the vagina. And that's inversion of the uterus. So that's what we want to avoid. When assessing the preterm infant, the nurse understands that compared with a term infant, the preterm infant has what?
I have no idea.
Yeah, well, that's correct, that the greater surface area in proportion to body weight. Why do you think that matters? Any idea why that's important to know? This is going to be related to thermostability and the baby's ability to be warm. So these babies get cold a lot easier. The preterm babies do. Kangaroo care is promoted regardless of an infant's gestational age. Which statement about this intervention is correct? Good. So kangaroo care is essentially just skin to skin, and it's going to help the baby's temperature regulation, help to keep the baby warm. What's the most important nursing action for preventing neonatal infection?
My Kahoot's being slow, but I guess I'd say standard, maybe. Oh, we go to hand washing. Well, I was going to say hand washing is a part of standard, I guess.
Yeah,
Yeah.
I suppose that's an accurate point. But definitely important, especially like in the NICU, because a lot of times you're going from baby to baby to baby to make sure you stop and wash and stop and wash. Which bacterial infection is definitely decreasing because of effective drug treatment?
I don't know.
All right, so for this one, Group B strep. Group B strep has a high mortality rate for babies that contract it. And so if mom's Group B strep is positive, we treat her with antibiotics during labor, and that is decreasing the prevalence of Group B strep infection for newborns. What's the most common birth injury? Fractured clavicle. Are you still there? Did I lose you? Hello. Okay, so we were just talking about how fractured clavicle is the most common birth injury for babies, and that's often with a shoulder dystocia that we can have a clavicle fracture. And oftentimes with that, what we see is a decreased range of motion on that side. So an unequal startle reflex, like when you startle them, the moral reflex makes both of their arms come up, and so it might not with a fractured clavicle. What should the nurse keep in mind when assisting the breastfeeding mother with positioning the baby? So for this, whenever we're talking about how to position the baby to help with breastfeeding, we want to go belly to belly. All right. So if they're holding their baby, like I'll see moms that hold their baby like they put them in this cradle hold like this, but they have them more on their back, and then they expect the baby to turn their head to latch, and that it doesn't really work. But if you have them take the whole baby, then the baby's head is aligned and they're belly to belly, and then it's easier to get a good latch. Which scenario results in nipple confusion? So now mine's lagging. All right, so the idea of nipple confusion has to do with the fact that the babies uses different muscles to suck on an artificial nipple, like a pacifier, than they do on the breast. And so there is a good benefit to pacifiers, but we want to wait until after breastfeeding is established to introduce them. Which hormone is necessary for milk production? Prolactin is what helps produce milk. What helps the milk let down for breastfeeding?
Is it lactogen?
No,
I don't
it's
even
not
know.
on. It's not on the screen.
I have no idea.
Ruby, do you know?
This one had the name.
She's talking very softly. I didn't hear what she said. Think about this for a second. When we talk about
Like oxytocin?
yes.
Okay.
Yes, I was gonna say if we have a patient who's just delivered and we need her uterus to contract, either we're not giving her Pitocin, she declined it, or maybe she's delivered on an airplane, or maybe who knows what, maybe we've done all of our things, but we still would like her body to release more because she's bleeding, lots of things like that. Putting the baby on the breast is a great thing to do to help that, because her body releases its own oxytocin. Mother asks if she should feed colostrum because it's not real milk. What would be the most appropriate response? So colostrum has, it's really high in fat. It has a lot of antibodies, proteins, vitamins, minerals. It is exactly what the baby needs to start life until the body transitions to mature milk. So definitely there's huge benefits. In administering vitamin K to the infant shortly after birth, what should the nurse understand about vitamin K? Why is vitamin K important?
I don't know.
Yeah,
Mhm.
because it's newborn stuff and we're just starting this.
Oh no.
Ruby, what do you think? Do you have any idea why vitamin K is important for a newborn?
I was thinking blood.
So for this, we're thinking about clotting factors. So a baby that has a risk of having what they call vitamin K deficiency bleeding because they're not the newborn gut is sterile and it's not synthesized. They're not making the clotting factors yet, and so vitamin K kickstarts that. And so those babies that don't have vitamin K given to them, or like in underdeveloped countries, things like that, they have a higher prevalence of vitamin K deficiency bleeding in their brain. So we just give them to them as part of their newborn meds. Infants in whom cephalhematomas develop are at risk of which condition?
Jaundice.
Yeah, we talked about this one. At risk for jaundice because that the baby's body has to break down that hematoma, and when it breaks down the red blood cells, it releases bilirubin, and hyperbilirubinemia is what causes jaundice. Any idea how we treat jaundice for a newborn?
Isn't it like a light?
Mhm.
Like some sort of light? Like I know like you see like babies and they're like glow worms.
Yep.
I
So
don't know.
it's phototherapy, and it's like a blue light. They have to have their eyes covered,
Hmm.
and then they're stripped down to just a diaper, and then the UV light helps their body break down the bilirubin so they can excrete it. Any idea how it gets excreted?
No, I guess not.
So once the bilirubin's broken down, they excrete it in their feces mostly.
Oh.
So we're also feeding these babies a lot to get them pooping.
Mm-hmm. Okay.